Welcome to Leaving Nothing to Chance, your go-to podcast where we bring you insights from some of the most influential voices in small business and personal development. Each week, we dive deep into conversations with top thought leaders, authors, and business moguls from around the world, sharing their secrets to success and strategies for growth. Tune in for exclusive content that will inspire, motivate, and equip you to take your journey to the next level. This is Leaving Nothing to Chance.
Welcome, everybody, to a new edition of the Top Doctor Magazine podcast series. Today, our guest is Dr. Richard Downs, and Dr. Downs has had an amazing career, and you'll find out about that today. And we'll talk about many of the things that he's been instrumental in creating. Dr. Downs is a graduate, University of Iowa, proud member of the United States Navy, served 3 years as a naval officer. In addition to that, he has been an inventor, a dentist, a creator, a co-creator, and an author of a book called Beautiful Faces. Doc, welcome to the show.
Thank you very much, John. I appreciate it.
And I don't even know where to start because there's so much to start with, but why don't we start maybe at the beginning? Small town Iowa, Monta, Iowa, right? Town of about
Montour. It's called Montour. Montour. Montour, yeah.
Okay.
Yeah.
And you got your first interest in being an innovator at a fairly young age.
I got interested in my home. I actually moved to a larger town later on. In grade school, I was in Montour, and then I moved to Marshalltown, Iowa, which is a town of about 20,000. And that was, I entered junior high school. It's called junior high there. And began to take some courses in science. I did enjoy that and started working on the athletic area called gymnastics. I did like gymnastics because I don't know, it's just a sport that I enjoyed. And then as I got into high school and learned about chemistry, I began to think that I liked that that field of knowledge. And I got a workshop scholarship and moved on to the community college there from high school. And then I went from there to the University of Iowa and eventually got my BS degree and then went into dental school from there.
And you had this interest both as a dentist and also as a kind of a pioneer in the dental field. And that seems like it's become broader than dentistry in itself. Is that correct?
I would say yes. I think that, first of all, we have a winning mouth rinse that we developed, I co-founded the company with Dr. Robert Martino and Burge Kalajian. And it all started with a lecture I gave in Florida. Dr. Martino asked me, I was a member of the Fortune Management, dental management community, and they asked me to speak. And he asked me what I'd want to speak about. And I told him I was going to talk about bad breath. And he began to laugh. And he said, okay, that ought to be interesting. So I gave the lecture down there. I presented a cytokine flow sheet and what chlorine dioxide would do if it was actually activated sodium chloride, which is a type of chemical that releases chlorine dioxide. Chlorine dioxide exists in a gas form and it doesn't last very long in the liquid. So I explained to them how we would make it and what we could do with it. And they got excited. By the time I got home, Burge and Dr. Martino were already interested in investing in a new company. And so that's where that started. About 2012, that happened. Without Burge, especially Dr. Martino, who now is the CEO of the company, I'm not CEO material at all. Dr. Martino is a genius in business, and he's made the company grow and it's doing exceptionally well. And we're now introducing a new toothpaste that'll come on the market probably this month, and it's totally innovative too. You'll be excited when you see that because nothing like it exists in the world. This type of toothpaste is made with cellulose microfibrils that are made from a Norwegian spruce tree. And I can't take credit for that. We found a place that makes that and decided to white label it for our company. But we did recognize, I did go to the lab and watch how they made it. And it was extremely interesting to me because I love labs anyway. I like to see how they do things.
And what is the unique selling proposition of this toothpaste versus others?
Let's put it this way. We did a independent study on it, and it was done in Cleveland by a company that does test toothpaste independently. They do a lot of different tests. This toothpaste with the microfibrils in it actually removes plaque about, I would say, 70 to 80% better than regular toothpaste. It actually, the little microfibrils of cellulose in there actually pull the plaque out of from between the teeth. But in addition to that, we put fluoride in it at the same level as most toothpaste, ordinary toothpaste like Crest and Colgate. And yet it outperformed prescription level toothpaste in fluoride deposition into the teeth. And when the people who tested the paste in Cleveland saw what it did, they wanted to invest in the company. They were like blown away by what they saw. So I guess the unique proposition is your teeth will never feel this clean and never have this much protection as compared to anything on the market. It's going to be totally innovative.
Great. And
Mhm.
that'll launch sometime here in June.
We're hoping to June. It's been delayed a couple months here, but it'll be very soon.
And distribution is through your dentist, or will it be?
Yeah, our company is built around dentists. We sell to professionals. Now, I don't know about the toothpaste. That might be something we do commercially with B2C, but right now our mouth rinse is all done by professionals. We don't sell it in Walmart or any kind of store. We believe that we want professional supervision on how to use that rinse because it's so special. Like I said, it's an award-winning rinse, and the studies on it are absolutely phenomenal as well. This 1-2 punch that we'll have, the rinse and the toothpaste, will be nothing like it in the world.
I'm excited to try it.
Yeah. Okay, good.
Tell us a little bit, once again, yourself and your partner, Dr. Martino, you guys revolutionary with hypochlorous acid.
Yes. Now, hypochlorous is something I wrote about when we formed the company called OraCare, but we haven't produced any hypochlorous acid in the OraCare company. So I'm actually, and I talked to Dr. Martino about it, and we may use it in the future or put a hypochlorous acid type product in our offerings, but we're not ready to do that yet. So I've started making some hypochlorous acid nasal rinses, and I have a couple of different strengths for that, and actually three different strengths for that, and different formulations for that. The one that we just put on the market went on Amazon. It's called Hyponasal, and this is the Brox Hyponasal, and that is about 100 parts per million hypochlorous acid. And we found some, although we don't have any formal studies on it yet, we do have studies that people have done in the past on hypochlorous acid. This one, though, is unique because it's made by the ion exchange system. There's no electrolysis involved, which is the way most hypochlorous acid is made. So there's no salt flavor to it, and there's no contaminants like hydrogen peroxide and ozone and other contaminants. And also, the electrolysis made product often has to be stabilized with acetic acid, and we believe that's harmful to the nature of hypochlorous acid. I don't know that you can even call it hypochlorous acid anymore, but people do sell it that way, and it's not as stable. This is really quite a unique product.
And I imagine it's good for allergies.
It's good for allergies. It cleans them out of the nose, but it also has an anti-inflammatory property. By the way, hypochlorous acid is made by your white blood cells. Your white blood cells, that's their natural way of killing microbes in your body, viruses, fungi, and bacteria. So when an invader comes in, they destroy it with hypochlorous acid. So it is really an all-natural product. My product is just water and hypochlorous acid. So it's completely natural, yet it's extremely effective. And it is anti-inflammatory, as I said, and we've seen anecdotal results with it shrinking the turbinates in the nose and opening up the airway for people to breathe better. We feel that it has a lot of potential.
And along that lines too, I think you've even developed a hand sanitizer. Is that correct?
Yeah, we have a hand sanitizer. I don't have a bottle with me, but it's in a little larger bottle. I don't know if you can see that very well. It's a black bottle. There you go.
Yep, there you
And
go.
and I don't have the label on it, but this is about twice as potent as the nasal rinse, and it is very good for spraying on surfaces killing the bacteria and viruses and fungi that are on surfaces. And we feel like too, you can take this product. The thing about it is you can't take like a Clorox wipe or a Lysol wipe that is made with quaternary ammonium products and put it in your mouth or on your skin. It's irritating, but this stuff, you can spray it in your mouth and swallow it because it's all natural. So your body makes it anyway. You can swallow it. You can spray this on your vegetables with the E. coli that might be there and maybe clear that up a little bit before you eat your lettuce or whatever. And you don't have to rinse it off either. You can just spray it, let it sit, and then eat it. It's pretty amazing stuff. And yet it's probably 100 times more powerful than bleach at killing microbes.
Wow. And nice and safe and
Very safe.
take it
You can spray it around your children and your pets, and it won't leave a smell. It's completely, and it actually removes odors too. By the way, so does chlorine dioxide. Best odor removers on the planet are those two products. Okay.
So let's talk about the thing that seems like it's epidemic, and that is sleep apnea, sleep disorders, lack of sleep, waking up, CPAPs, all of the above.
Yeah. As you might, maybe the viewers may not know, but I'm very involved in sleep apnea, sleep disorders training. I train dentists in that. We have online courses for people to get certified in dental sleep medicine. And also I work with chiropractors and nurse practitioners in training them as well. And so then Dr. Zelk, who is my partner in writing this book called Beautiful Faces, this is the book here, Beautiful Faces, and that just went on the market in January. And it talks about the fact that we're now, with dentistry, we can do more for patients than anybody else. In my opinion, when dentists can widen the mouth, make more room for the tongue, especially if they expand the palate, we actually, with those procedures, we can actually widen the nasal passage as well, because the floor of the mouth is the floor of the nose is the roof of the mouth. So when we split that suture, especially on younger people, we increase the volume of air passage for both the nasal and the oral pathway. And we can also bring the tongue out of the throat, which has been constricted by our faces. So what the book is about, John, is we believe, we know this is true, that when we widen the upper arch to its genetic potential, in other words, none of us are living up to our genetic potential as far as the filling out of our faces. We have shrunken faces in modern society. It's not like it should be. And we've actually gotten used to seeing people the way they look right now. My long, narrow face is not normal. This is called a dolichocephalic face I have. And if you look at me from the side, I have a receded chin, and it's all related to the fact that our faces are not developing like they should. That narrow face and constricted tongue is what's contributing to that, I believe, the epidemic of obstructive sleep apnea in modern society, and it's killing people. And there's almost 80 million people within the US that are walking around with obstructive sleep apnea that are undiagnosed and not untreated. And so we wrote this book in order to start changing that. And there's a lot of pictures in that book showing how dentists are now, they're not the only treatment, of course. We want the diagnosis done by the medical professionals. We don't want that responsibility, of course. But we can do things that other people can't do, and that is create an airway, especially upper airway, that is more beautiful as we get back to our genetic potential, but also healthier. We believe beauty and health go together. And generally, that's always true on most things about the human body. A healthier body also looks better as well. And the smiles that we're creating are absolutely gorgeous. And yet we're getting results. As a matter of fact, if you look at Vivos, which is one of the innovations that widens the arches, Vivos Therapeutics, they actually have FDA approval for using their appliance for sleep apnea. And about 25% of their adult patients are actually cured. Now, I'm not supposed to use that word cured. I get in trouble with the FDA. So I would just say it this way. 25% of the patients have sleep metrics that no longer are used or can be shown to have obstructive sleep apnea. In other words, their metrics are within normal range after treatment with that product. And essentially a cure, if you look at it just with the metrics, the diagnosis of the metrics. Okay.
And I'm fascinated by that subject. I've had sleep apnea for 20 years. Lost 80 pounds, figured it would go away. It still didn't go away. So I'm personally interested in this, and I know a lot of our listeners are. And I know a lot of women are affected by it. And I think when I first heard about it years ago, I went to a sleep center here in Dallas, and they stay overnight. They hook you up to a million machines and take a lot of readings to tell you what you already know, that you're not sleeping very well. And then you get the machine, and the machine does help. But I got a couple of questions on that, Doc. One is, it seems like a lot of women that are not even overweight are suffering with this, and it seems like some young people. You're hearing of young people even dying from sleep apnea. Am I correct in that? And if so, what you just talked about what's causing this, but more importantly than the cause is, how do they find out about this? Because this is very important, groundbreaking.
I developed an online website for people who want to do a sleep study, and you can do it in your own home. And it's called onlinehomesleepstudy.com. And people can order that. Any patient can order that sleep study. It has to be diagnosed by a sleep doctor, and they can then get a prescription online with us, and they can go and get treatment prescribed by the MD. And with Dr. Joe Zelk, who co-wrote the book with me, he'll write a prescription for all the alternative treatments other than CPAP. In addition to, he does write prescriptions of CPAP, of course, because some people have to have that. But there are a lot of things we can do, and he'll prescribe orthodontic care that will expand your arches. He'll actually prescribe that. He'll prescribe Excito-SA, which is a tongue stimulating device that strengthens the tongue. He'll prescribe oral myofunctional therapy. He'll prescribe Bongo RX, which is an EPAP therapy. He will prescribe the nasal rinses that will help them breathe better, and the nasal dilators. And there's a myriad of things that we can do that would help these people. Even the night lace procedure, which is a non-ablative laser that shrinks the tongue by popping but with apoptosis of the fat cells in your tongue, and also strengthening the upper soft palate so that it becomes tight again, and it helps open the airway. That night lace procedure is another way that they prescribe now. So I guess I'm off track here, but the young people, yes, they do get it. We have children, even my nephew, who was stopping breathing, and he was like 2 or 3 years old, and you can see that they stop breathing when they're sleeping. And the snoring should never be considered normal. It's not normal. And women, as you mentioned, tend to catch up with men with sleep apnea after menopause. But even young women have problems with this, and women tend to suffer more from upper airway resistance syndrome, called UARS, than men do. And younger people tend to have UARS, but some people don't think that's worth treating. We do not think that should be let go, and we believe it's a precursor to the later stages of obstructive sleep apnea, which are much more devastating to your health, causing heart disease, stroke, even contributing to the incidence of increased weight and cancer. Now, you're right, John, about the fact that losing weight doesn't cure you. It does lessen the number of events that people get, but the vast majority of people cannot get rid of obstructive sleep apnea by just losing weight. You can lose quite a few, and it can help you a great deal. But each time you do lose weight, if you do it over and over again, the effective weight loss becomes less and less effective on the obstructive sleep apnea.
Yeah, I found it fascinating as I was reading some of what was sent to me, Doctor, to reference that modern diet has been such a contributor. How
We're not chewing things that are tough anymore, and that used to be something that we did as Aboriginal people. We would bite into tough foods and leathers and meats and fruits and vegetables. Now we blend things and swallow it. The other thing is we're way too much sugar in our diet, especially the soda. They're even putting sugar in sausage, for crying out loud. It's just ridiculous. It's everywhere. And Fructose is a definitely body inflammation producer, and it creates fatty liver. People don't realize the liver damage that sugar is causing to them. It contributes to constant body inflammation, and that inflammation influences the muscle tonicity in your throat and can make the muscles less reactive as far as being able to overcome the collapsibility of these muscles in your throat. So it has to be controlled. Our modern diet, there's much more to it than that. There's plenty of toxins out there, and there's even a thing I talk about called domestication syndrome, which is in the book. I've written, I think in the book, there's about 15 things I've referenced as causing or contributing to our shrunken faces and airways.
Interesting.
Yeah.
And so you retired in 2012, is that correct?
No, I did not retire. That's when I helped start the Oracare company. I retired about 5 years ago. Yeah, just about 5 years ago from my dental practice.
Now, I don't know what your wife says about this, but I'm going to imagine that the term retirement you're using very broadly, because it doesn't sound at all like you're a retired guy.
She knows me well enough to know that I can't sit in a rocking chair and go golfing every day. I'm just not going to do that. I have a vision. You can see behind me the picture of Haiti. I have a vision that the Lord has given me to bring a specialized clinic to Haiti, in which would become destination education in implantology. I have a diplomate degree in mini implant dentistry, and there's a number of doctors that I've worked with who are much more knowledgeable about implants that would teach courses there, as long as we can assure their safety. And I think we can do that and give us not only a place where people are taken care of, but the training that dentists need, and then also would become an economic hub that would be a crucible for change in northern Haiti.
Great.
Yeah,
That's something that's certainly needed. That part of the
yeah,
world is taking
yeah, it is.
such a
Yeah,
beating.
it's a sad. I've been there about 3 times, and it's a beautiful country, but there's too many corrupt governments,
Yeah,
unfortunately. Yeah.
no doubt. I want to come back to something though, because like I said, the sleep apnea, this whole thing about sleep, and no matter what doctor, and I talk to a lot of people, obviously in your profession, not only doing these interviews, but doing some of the other things I'm involved with. And it seems like the word sleep is something that's been identified by the medical profession, and for that matter, the non-medical profession. You talk to a personal trainer, they'll reference it. You talk to a dietitian, they'll reference it. You talk to whomever that's interested in health, and sleep has become such an issue. And maybe it always was. Maybe now we're just know more about it than we did 50 or 100 years ago. But some of the things that you're doing here can really help people to sleep better. And how important, I guess, is my question, doctor, how important is it to get sleep, maybe not a certain amount of hours, but that restful REM sleep? You get up and you go, okay, let me go attack the day versus having the day attack us. Can you talk about that a little bit and elaborate on some of the things people can do in addition to some of the products and some of the remedies that you're talking
Mhm.
about to get that restful sleep?
One book I'd highly recommend is Dr. Walker's book, Why We Sleep. It is absolutely beautiful book, wonderfully made. I've referenced it in my book. There's another one called Jaws. There's books about developing the face in larger jaws. But I believe that sleep at a minimum of 8 hours is probably what most people need. Somebody that's at my age might do fine with 7, but I don't think under 7 is ever recommended for any age. And also, it's been shown that if you sleep over 9 hours, it actually has a negative effect on you. There's a sweet spot there from 7 to 8.5, 8, something under 9 hours. And you want the sleep not just to be in length, but it needs to be restorative sleep. Restorative sleep, as you mentioned, John, has to do with getting enough deep sleep and REM sleep. Those are the last 2 stages of sleep. They used to have 5 stages, now there's 4. And the stages 3 and 4 are the ones that need to be improved. And if you're suffocating all night, by the way, I like what Dr. Joe Zelk says. He calls sleep apnea sleep suffocation. You're actually suffocating in your sleep. So when you sleep and you stop breathing, your blood oxygen levels can go down below 80. And some people, I've seen it in the 60s and lower. It's unbelievable. This is crash cart level emergency. And yet you don't notice it because you're asleep. But each time you have an episode where you choke and actually suffocate, you actually come out of the deep stages of sleep and enter the light stages of sleep. Even though you're not conscious yet, you woke up and you're waking up all the time and you can't get into those deep stages. As a matter of fact, for most people, the collapsibility of your airway happens during REM sleep. And that's a stage in your sleep when you're actually paralyzed. Your body, your muscles are not moving. And it's necessary because generally that's where the stages where you do most of your dreaming. And if your body wasn't still, you might act out too much in your sleep, violently or recklessly while you're sleeping. It's made that way. But your REM sleep is something that is disrupted. Your deep sleep is disrupted, and you're not getting restorative sleep. Now, you need the deep stage 3 sleep generally around physical restoration, and you need the REM sleep, and that's generally assigned to psychological restoration. And also, those stages tend to solidify your memory. So if you're trying to go to school and learn things, if you're not getting your sleep, you're staying up all night, it can be a self-defeating exercise because you're not allowing the reorganization or the concealment, or I say congealment of memories in your brain. I hope I answered your question. I went a roundabout way.
And it leads me to my next question.
Yeah.
Do you believe from all the research that you've done and continue to do, talking about the brain, right? You just referenced it with memory.
Yeah.
Other diseases that we're seeing more. I saw something recently that Parkinson, for example, I may be off on my number here, I think by 2050, it's going to be rampant. Alzheimer's or dementia, for example, all these brain related diseases that our grandparents didn't die from. They died of cancer or heart disease at fairly young age, probably, right?
Yeah.
But
Yeah.
now we're seeing, because of modern medicine, people surviving longer. And I use the word surviving versus living because in some cases they're surviving on different things. But nonetheless, doctor, my question is all of this would seem to work for good night's sleep,
Mm.
good breathing ability with some of the products that you've developed, good airways, lack of sleep apnea. All those things in a perfect world are things we should endeavor to do. But do you think the fact that most of us are not doing those things very well, are leading to some of these brain related diseases that we're hearing more and more of?
Yes, John. There's a lot of articles out there that associate dementia, Parkinson's, depression, psychosis, all kinds of brain-related diseases to the hypoxia that you have when sleep occurs. And there are new metrics coming out to determine how long you're in those hypoxic episodes. And then let's say you're sleeping one night and you're monitoring your sleep and you hit 81% oxygen, but it was like for a couple of seconds. That is not as difficult for your body to take control of or handle as it would be if you were down there in that zone for, let's say, 10 to 30 seconds. And some people, I've seen films of people that are unable to breathe for 60 seconds or longer. It's incredible. And imagine the amount of inflammation that creates in your body, the amount of hypoxia to the brain that's occurring, and what your body has to do to overcome that. There's a spike of cortisol in your body, which is the stress hormone, and that is harmful all over your body. We all know what stress does to you. It's got multiple problems, but sleep apnea can cause multiple diseases, not just the few we've mentioned. You're talking about tremendous numbers of brain diseases, heart diseases, strokes, cancers, weight gain, as we mentioned, high blood pressure, diabetes. It's unbelievable. We're looking at now a new thing called type 3 diabetes. It's related to sleep apnea. It's hard to believe how many things it affects. Because when your body's, let's face it, you can go without water for maybe a day, a couple of days. You can go without eating for maybe some people 30 days, who knows, but you can't do without air very long at all, maybe a few minutes. And it is the most important nutrient that we get, and it's the most immediate one we need right now, all the time. Yeah.
Great information, doctor, and
Yeah.
necessary, and something that we are all, whether you're in the medical profession or you're a layperson, needed information. So thank you for that.
Mhm.
Let's talk about something a little bit more fun. You were recently the recipient of the Blind Faith Sculpture Award, recognizing significant contributions to healthcare. The symbolism of the award resonated deeply with your patient-centered approach. And I can tell just talking to you, I would love to have you as a doctor, and I think anybody else would.
Oh, thank you.
So thank you for that. But talk about what that award meant to you. Your career is far from over, but to recognize your so many contributions already to your
Mhm.
profession.
John, I'm not, I apologize, but I don't know what that award is. I apologize.
It was an award that you were nominated for this award recently.
Okay.
You didn't
Uh,
win it yet. You were
okay.
just nominated for. You may not even know that. I just got the.
I don't know about it. That's something new to me, John. I'm honored, but I don't know where it's from or who would do that. So it's nice to know.
Actually through our friends at Top Doctor Magazine, the
Oh, okay.
uh,
Okay.
Island and the folks there, and
Okay.
you were just nominated for. I guess I'm giving you this information. It's feel like I'm at the Academy Awards.
Thank you. I'm pleased, and I would love to see the result, see the reward award, and understand. I'm very honored by it, of course. I think that Top Doctor magazine has a lot of esteemed colleagues and professionals in it that I highly respect. So to get that award would be very meaningful to me.
Great, and but yeah, the significance of a nomination like that. How does that make feel that all these many years of hard work are being recognized by your colleagues in the medical profession?
John, I don't want to sound, I feel like my life is any success I've had has been a result of my relationship with my Lord. It's like he keeps bringing these things to me. Let's just take, for instance, the oral care company. Dr. Martino called me out of the blue, asked me to speak in Florida, and I told him I'd talk about bad breath. And by the time I got home, I had $400,000 worth of investment in a new company. I don't, I can't sign that to me. I really can't. I think that's miraculous. How many companies can do that? And then just think about this, John. Just think about this. All of our investors, we had more investors after that, all came from the dental profession. Now, ordinarily, when you develop a product, okay, you have to go out and find buyers. All the investors were buyers. I had a built-in retail base, a B2, B2B was already built in. All these investors had a vested interest in making this company work, and they would buy it and give it to the patients. So talk about extraordinary. It's just extraordinary to me. It's like it was all set up for me. Okay. It's not me. It really isn't. I That might sound like I'm being too humble, but I don't believe, I really do believe that I've been given a gift, and and everything else that's coming now is still a gift. It just keeps falling into my lap, and I don't know why. I really don't know why. It's wonderful though.
You're a humble, you're a humble man with a broken.
I see that's the problem. You try and do that stuff, and then you think you're trying to heap more praise on yourself. I'm really not doing that. I really want the focus to be on what God's doing. Okay.
I certainly,
Yeah.
I'm sure many of our listeners will.
Yeah. Yeah. Yeah.
We're all lucky every time we get up every in the morning.
That's the truth. Yeah. Yeah.
So let's talk as we start to wrap up, Doc. Let's talk about where they can get more information. Is the best
Oh,
usaguard.com or is there another website?
okay. We just now made hyponasal.com we took on, we captured that domain name. So hyponasal.com. You can get to all the information you need on hyponasal. The book is beautifulfaces.com. So we have that URL. So you go to beautifulfaces.com, you'll see all these beautiful pictures of people that are getting better with the dental care that we're doing for their sleep apnea. And then I think that those two sites would be probably the most, and for professionals, I have sleepbalanceacademy.com for people who want to get trained in sleep medicine. That would not be for the general public. That's for professionals only. And they can get a hold of me there too. Okay.
Give,
Yeah.
give that third one again. You said that kind of fast.
That's sleepbalanceacademy.com. Sleep Balance Academy.
That's for the medical profession.
Yeah, that's for medical, dental, anybody that's a health professional who want to buy products at wholesale and resell to their patients. I think that would be a good place to go. We just put Hyponasal on Amazon and Walmart. They're up now. That just came on. So you can get those products and you can get the book at Amazon and also Ingram Spark. Now, Ingram Spark, those two references for the book are on the Beautiful Faces website. You know, you just click on the links there and it'll take you to the places to buy those. So those are there if you want to buy the book.
Great. Beautifulfaces.com. So what's the family think of Dad being an author now?
Oh, excuse me, I said that wrong. Beautifulfacesbook.com. Okay, I should say that. Beautifulfacesbook.com. I should have said it, left off the word book on that. Sorry.
So beautifulfacesbook.com is
Yeah.
all these
Yeah.
other.
Yeah.
What's the family think of your newest venture of being an author?
None of them have read it yet. And you have to say, for a consumer book, there's a lot of technical information. There's over 500 and there's more than 500 references in the book, 500 footnotes and references. Even though and I tried to I explain words in there for the common reader. And so you do have to wade through it. It's not like a page turner. It's not a fiction, but it is interesting in my opinion. And the people who have read it said it's really good. So far, that's what I've heard. But I do think that professionals would get a lot out of it too, to get an overall view of what's happening in sleep medicine on the dental side and also the medical side, because Dr. Joe Zelk is the medical practitioner who co-wrote the book with me. I'm so glad I had a sleep specialist help me write that book. He's the best thing that ever happened to the dental profession, in my opinion. He's been fabulous.
And he's an MD, correct?
He's a doctorate of nurse practitioner, and he has 2 doctorate degrees in sleep medicine. So he's pretty credentialed, yes.
Great. So, Doc, last question: what's ahead? You've done a tremendous amount in your life already, but I know you've got aspirations in the coming years. What's ahead for you?
I still want to innovate for oral care. Dr. Martino is an absolute gift. I think that he's going to be. Without him, we wouldn't have a company. Just plain and simple, there wouldn't be one. He's made it successful. For me, I have other products in my head. I have a healing gel that I'm going to be making. I'm going to be making a different kind of nasal rinse, and I'm making something for younger children as well.
Great. Well, Doctor,
I want to help them with breathing. Yeah.
This has been both a privilege and
Yeah.
Doctor, and continued good results. And everybody needs to get up to beautifulfacesbook.com.
There you go.
Get the book and
Get the book.
learn more about this very important. And we've had some fun here. We've had a couple laughs here, but at the end of the day, this is a very serious subject that we're tackling. And Doctor, I'll give you the last word. Anything else you'd like to share with the audience?
Oh, I appreciate this. I've got to know Dr. and John Hyland and now you, and I think this is a quality organization. I feel privileged to be able to work with you. And also, I think that what you're doing is going to help a lot of people. So I appreciate that so much. Thank you.
Thank you. Thank you as well.
Thank you for tuning in. Be sure to check back weekly for more exciting episodes. And don't miss Ink and Insight every Wednesday, where we celebrate iconic authors and dive into their impactful works.